Today I am going to show you the surgical removal of a horizontally impacted right mandibular third molar. You can see that the third molar is lying horizontally and is locked by the second molar. The apex of the tooth is close to the mandibular canal with approximately 1 mm of the bone between the apex and the canal. Most of the tooth is covered by bone and only the distal half of the crown is outside the bone. This can also be seen in the clinical picture where only the distal cusp of the tooth are visible inside the oral cavity. This video is not going to be like my other surgery videos. I will not be showing you all the steps in detail. This video will be focused on how I section such horizontally impacted teeth. For this surgery, inferior alveolar nerve block, lingual nerve block, and buccal nerve blocks are administered. For a detailed explanation on these blocks, you can watch these videos on the channel. Then I place a Watts incision and reflect a full thickness mucoperiosteal flap. For detailed explanation on Watts incision and flap reflection, read this article and watch this video on the channel. I create ditches in the buccal and distal bone with a HP6 round burr. This is how the ditches look like. I connect those ditches with a HP702 straight burr to create a bone gutter buccal and distal to the tooth. This is how the bone gutter looks like. Now come the step where I section the tooth. But before I show you how to section the tooth during a surgery, let me explain it to you with the help of a 3D animation. I have created this 3D mandible with an impacted tooth. You can see that the third molar is horizontally impacted and is locked by the second molar. Let's zoom in further. As always, I first create a gutter, buccal and distal to the impacted tooth. Then with the HP6 round burr, I create two ditches on the buccal surface of the tooth as close to the cemento-enamel junction as possible. I prefer sectioning of the tooth at the CJ level because the cementum is easier to cut whereas enamel is very difficult to cut. Then with the 702 straight burr, I connect those ditches to create a section. At this point, the section is not complete as the burr reaches only till the half the width of the tooth buccolingually. So I widen the section with the wider 703 burr. Now with the wider section, it will be easier to access the lingual half of the tooth with the 702 burr. The section that I created is a little dark and we cannot see inside the section. Let's brighten it up. You can see that 1 to 2 mm tooth structure is intact on the inferior side and the lingual side of the tooth. This is done to prevent injury to the inferior alveolar nerve and lingual nerve. For more details on this, you can read this article. I place the couplant elevator inside the section and rotate it. This fractures the section and separates the crown and root. The crown is then removed from the socket. To remove the roots, I place a crier elevator inside the distal gutter and push the roots out of the socket. So that's how I am going to remove this horizontally impacted third molar. Now this technique is quite difficult to execute with a straight surgical handpiece. Also, I never expect the cut that I place on the tooth to be straight buccolingually with a straight handpiece. It is possible only when you use a contra-angle handpiece. Many oral surgeons prefer hemisection of the tooth because it is easier to do with a straight handpiece. It is their preference and I totally support it. When there is no other option, I do perform hemisection. You can watch this video for that. So coming back to the actual surgery, after bone guttering, I place ditches in the tooth at the CJ level using a HP6 round burr. Then with the 702 burr, I connect the ditches and create the sections in buccal half of the tooth. With the 703 burr, I widen the section. Then again with the 702 burr, I section the lingual half of the tooth. I then fracture the tooth at the section using a couplant elevator. The section crown is then elevated with a crier elevator and removed with the artery forceps. Similarly, I elevate the roots with a crier elevator and remove it with an artery forceps. The flap was sutured with 2 interrupted sutures. This is the section tooth. As shown in the video, the section is not straight, but it doesn't matter as the tooth is out with minimal bone removal without any issue. 6 days post surgery, the sutures were removed, and this is how the healing was at that point. That's me with my dedicated surgical team. I want to extend my heartfelt appreciation to my surgical assistant, who also happens to be my PG student. Without her invaluable support, this surgery wouldn't have been possible. I'd also like to express my gratitude to my talented videographer, who's also my student. He was instrumental in bringing this video to life. Last but certainly not the least, I want to give a huge shout out to my patient, who is also one of my students. She graciously agreed to have the surgery documented, making this video possible. Thank you for watching.